Good evening, it's Dr. Mike. You wanted a video on Venlafaxine? Well, alright, it's an update. It's easy. Venlafaxine, also known as Effexor. I call it side Effexor. Okay, what's good about it? There's a small percentage of patients where SSRIs or NRIs or tricyclics are not strong enough. Or you don't want to do stimulants with an SSRI, hopefully. In this case, an SNRI, very potent, nasty, pure form is Venlafaxine. It's really the first SNRI, technically. Since then, you've seen Cymbalta or duloxetine, and now Prestige or Venlafaxine. So Venlafaxine itself is becoming outdated. It's good for a small percentage of patients who need a stronger antidepressant than an SSRI, and who don't want to take, 2 or 3 antidepressants at once, which I don't blame you. It's sort of like conceptualizing Wellbutrin and Prozac in one pill. Now, it's extremely potent. That could be good or bad. It's good because it can pull you out of a bad depression. But it's bad because it can make you agitated, activated, restless, hypertensive, tachycardic, and have a heart attack, essentially. So you don't want to take too much. Just enough to get you out of your depression. So generally I don't go above 225 ever. 150 is pretty strong. 75 would be great if that works. 37.5 is the usual starting dose. And these are the long-acting capsules, those big reddish-looking ones. Venlafaxine immediate release had come out first. Those are the nasty shaped pink house-shaped pills that are 3 times a day, and if you miss a dose, you crash into a suicidal depression. So I don't like the immediate release Effexors. I only use the XR, extended release capsule. What else is good about it? There's not a lot of protein binding. But Prestige or Venlafaxine is essentially making it outdated. I mix it well with lithium, Depakote, Tegretol. For the activation, I often prescribe low-dose Benadryl to counteract that. Now, a frequent mistake is anytime it's prescribed twice a day instead of once in the morning. Think about when you're taking your second Effexor. Why the hell would you take it before bed? It's a stimulating antidepressant. So you better ask your doctor, what do you mean by twice a day? When do I take the other one? If you're taking Effexor at night, you're probably not sleeping well. It can also make you restless, sweaty, nervous. It's serotonergic at doses below 150, so I don't mix it with SSRIs. That's a bad idea, because you can get serotonin syndrome. And at doses above 150 milligrams a day, it acts like a tricyclic. So you got to be careful with those effects of side effects or Venlafaxine. It's once in the morning. Okay, that's it. If you need more than that, then you better discuss it with your doctor. Sometimes I'll give it in divided doses, 1 in the morning, 1 in the later afternoon. But never the second one before bed. Think about that. It doesn't even make sense. How are you supposed to sleep like that? Does it help bipolar depression? You gotta watch out because you can get manic off it. What you don't mix is other stimulants of any sort. Like, I don't mix stimulants, psychostimulants like methylphenidate. You're asking for trouble if you're gonna mix it with amphetamine or street drugs like cocaine or methamphetamine. It also is very dangerous with alcohol. For medical problems, I would not take it if you have heart disease or high blood pressure. There's other ones like sertraline, if possible, or anything else than that for someone who has uncontrolled hypertension or recent heart attack or an MI or unstable angina or palpitations, tachyarrhythmias. Let's see, what else? It went generic recently. It used to be expensive. Now be careful because they're going to market some super high dose. So I'd be real careful, again, because of cardiovascular complications. Effexor is so potent that the PDR, physician desk reference, lists things that can happen when you stop it. Fasciculations, confusion, etching. So it's very potent. I try not to prescribe it first line. I'm using the better version, Venlafaxine, more often as a first line agent, or even Cymbalta in some cases. Again, it's mainly for depression. I know it's approved for anxiety, but think about it. How can that help anxiety? It makes you anxious. But anyway, if you do get relief from anxiety with it, you're lucky. It's a good response. There's sexual dysfunction, like with SSRIs, especially at doses below 150. If you wouldn't want to mix it with, say, bupropion at doses above 150. So, the dosing's important with this medication. I hope this helps you if you're taking Effexor. And if you have any questions, please post a comment. Thank you very much.